We're proud to be celebrating 35 years of advocating for women's health and wellbeing in the Loddon Mallee region.
There were many women in this community who fought for this organisation to even exist and who have worked tirelessly over countless decades now to expand the organisation to the much larger presence that it has across the entire region.
Over the years, we've had some name changes. We've also had some logo changes, because who doesn't love a good logo?
The representation of what looks like a sun was intentional, and it was representative of water. They were heavily informed by input from Indigenous women. The previous CEO before me, Georgie Rivendell, had a lot of connections into the Aboriginal community, particularly in Nyunda and Echuca and Rivendell, and so that became a constant theme. Regardless of how a logo was revamped, it was still there.
And of course we've had some changes to our location.
The thinking was quite groundbreaking for the time to purchase a standalone building, and that was to give security of tenure for a women's health service. It was the first time it happened in Victoria. It was very significant. We received quite a bit of feedback from women that when we moved from a more central position in Bendigo with a higher profile sort of on the street front, there was an increase in women who came in to talk about violence and what was called domestic violence or violence against women at the time.
As needs have changed, we've adapted. Moving from service delivery at a time when there were gaps for women to upstream advocacy, which is where our focus is now.
I think that the women's clinics were something that people understood quite clearly. The outreach for that was quite extensive. So we had women's clinics here in Bendigo, but also in the Oyen office. We had an office in the Mallee.
In my time, it changed between defining more clearly what upstream meant. In Oyen, the women there were loved by that community, and it was seen as a really, really important thing, which just made it so hard to say farewell to them. But in the end, the role of the service sort of changed how it did its delivery.
All throughout our history, we've advocated for change and for the improvement of women and gender diverse people's health and wellbeing.
So getting gender and health recognised in that original 2002 Women's Health and Wellbeing Plan was a bit of a breakthrough. It's assumed now, so this is the legacy stuff that it's nice to think that people would assume, of course, it would be part of any health and wellbeing planning, but it wasn't back in the day.
The gender equity cards that were done were a conversation starter tool, and those cards were ways of articulating what gender equity is, because we had the issue of trying to explain what we were talking about to people who didn't understand.
We know, and the evidence proves it, gender equity doesn't mean you give something up. It actually means that we all gain something together.
One of the biggest breakthroughs was the recognition of violence against women as a responsibility of the government. So that came through right at the end of my time when Victoria recognised that violence against women was a crime. So that then meant that they funded services, and they did put some money into the primary prevention, which was the role for women's health, Loddon Mallee.
And we knew that the data that was being collected around women's safety and in terms of, gender-based violence was red on every map. But the important part of that work was to actually engage with women, girls and gender diverse people, because their stories, their lived experience is the data, is the qualitative evidence to the work that needed to be done. We then developed the next iteration of a regional strategy called the Collective Action for Respect and Equality, or the CARE Partnership. That was absolutely essential in foundational partnerships to take action.
Sometime during my time, issues of abortion came up. Now that had always been present, but medical abortion was something that was becoming more available, so it was trying to get doctors to prescribe it.
In the Loddon Mallee region and in rural Victoria, access to abortion services were so difficult and in many regions non-existent.
So you try and get the morning after pill in the local chemist, where a pharmacist might be a male Catholic. There were barriers. Equally in Bendigo, women couldn't get an abortion in Bendigo because doctors feared losing their consulting access to the Catholic hospital.
It was important for us to look to see strategically, how can we create a framework to generate conversations, to generate change. So we did develop the first regional sexual and reproductive health strategy called Her Health Matters. And in its first iteration, we travelled across the region talking to people about things that were important to them.
When it comes to, mental health, there are a variety of ways in which women are unfortunately overrepresented within the patient population.
In understanding, what mental health and wellbeing is, it's actually saying, well, how do we address some of the inequities that sit behind that?
Women's Health Loddon Mallee has been really key in starting to think about how we have conversations to ensure that policies that exist around mental health are actually purpose-built for women, and ensuring that we actually have lived and living experience representation.
So when someone can see themselves in the stories that get told, they feel a connection. We actually introduced Women in a Changing Society.
We were starting to become really aware in 2006 with the drought of a huge impact on women's health.
I always remember water being a super scarce product, and when it rained being like, oh my God, it's raining, because it didn't rain that much when I grew up.
And looking at it from an intersectional lens, so how does that experience affect a woman who is from multicultural background, living in a rural area, who is feeling quite isolated and natural disaster hits?
And yes, women understood the link between the increase in violence they were seeing because of that, but they were so overwhelmed with what was at hand and surviving, they couldn't take on the bigger issue picture of that environmental issue.
A key program within that priority is actually Women Rising. That work has been beautifully translated into evidence, and that evidence has been taken at a statewide level, presented at many conferences, national level as well, really promoting the importance of understanding where inequity occurs through natural disaster.
There's a new portfolio, and that is chronic disease prevention.
Women are not represented in research, clinical trials relating to things like chronic disease management.
The Victorian Women's Pain Inquiry had an incredible response, and we worked really closely with that inquiry in our region, bringing people together to talk about pain.
We can make such a difference in helping women, particularly in regional and rural areas, understand what's available for them so that they're not on their own.
If at the very least we can actually put that gender lens and the inequity around women's pain as part of that chronic illness, that would be a very, very helpful thing to do to address inequities in terms of health outcomes.
I would love to see every rural and regional woman know what Women's Health Loddon Mallee is, and to feel as proud of it as I do, because they can see the change that this organisation has made.
When I think back to the start of Women's Health Loddon Mallee, the world has changed so well for women.
We need a new generation, a remotivation of advocacy and understanding that these hard-won gains can be very easily lost.
We can't have change without the small conversations that become the important conversations, because the work's not done.
Imagine if we had a world where girls and women felt safe. Now is the time to turn promises into progress.